So what is critical appraisal? Burles sums this up nicely in his quote here. Essentially, critical appraisal allows you to assess the strengths and weaknesses of research methodology used and can help provide a basis for your clinical practice decisions. It can be particularly helpful if you've got different research on the same topic that has come to different conclusions. Ultimately, you're trying to decide whether the research is being conducted in a way that means the results are reliable and generalisable. You do this by undertaking the process shown here. So you consider the evidence, you look at its validity, the results and the relevance, and then decide whether to accept or reject the paper. To consider validity, there are two factors you need to look at. Internal validity centres around design and conduct. So you're looking at whether the methods that we used mean that it's actually measuring what it is supposed to be measuring, and whether it's measured those accurately. You're looking at the quality of the paper, essentially. Secondly, you've got the external validity, and that relates to how relevant the results are to your wider population. So can the results be applied to your setting or patients? So how to appraise it? The best way of appraising research is by applying a series of questions to your reflections. You can then weigh the various factors up and decide whether the research presents reliable and relevant evidence. Specific checklists are available for each type of study, but there are some basic questions that you can apply to all forms of research. The first thing to consider is the study question itself. Is it relevant and clearly defined? Does it add anything new, or is it simply rehashing old ground? The next thing to consider is the type of study that was used. So is the type of study that has been chosen actually relevant for the question that the study is trying to answer? And there's a quick refresher for you here on which studies are appropriate for which type of question. The third question is around the design of the study. A high-quality study will have been well planned, well thought out, and the write-up will contain lots of detail. So you're looking for lots of detail about the methods, the selection process, the intervention itself, etc. So was the sample size big enough? How were aspects measured? The use of recognised and valid scales is key here. Some people use the methods section alone to quickly assess whether the paper's worth reading or not. The next aspect to consider is confounding factors and bias. So think about things like age, gender and comorbidities and how they might have affected the results. If there's potential for bias anywhere, there can be bias in how you select or recruit, how you carry the study out, how you report or interpret it, and attrition bias can be a factor too, if participants drop out at any point. If there are any factors, the key thing is that they've been acknowledged and measures have been taken to counterbalance it. Next, you need to consider the results of the study. Was analysis performed correctly? Are the results clearly presented and do they actually make sense? From looking at the data, do the conclusions seem to be justified? Check whether p-values or confidence intervals have been calculated. One or other should be present and helps demonstrate how likely it is that the result happened by chance and not because of the intervention. Finally, is the result actually relevant? Is the population of the study representative of your patient or patient group? Are the results generalisable? So think about cultural, funding, policy differences. Also take into account the number needed to treat. So on average, how many people would need to receive that intervention for one patient to benefit? Also think about side effects. Odds ratios, if given, or risk ratios, can help determine how cost and outcome effective the intervention might be. Here are some recommended resources if you would like to find out anything more about critical appraisal and evidence-based practice. And if you have any specific queries, or would like a member of the library team to run through the process of critical appraisal together with you, please just drop into the library or contact us using the details given here.